Good morning, everyone. Welcome back to our today's episode where we will be talking about coma versus vegetative state versus brain death. And in today's episode, we have Dr. Deepak Agarwal, sir, professor in neurosurgery, AIIMS, New Delhi. Sir, what is coma and what is vegetative state and brain death actually? And can you try to explain the difference between these three?
In layman terms, everything between coma, brain death, and vegetative state is considered as coma. So we talk it simply so that people can understand. However, there are major differences between the three. Any state where patient is not conscious is considered coma. However, when this coma progresses to a state where patient chances of coming back or becoming conscious are almost zero, we sometimes call it vegetative state. There is a lot of other criteria for its definition. And brain death is when obviously we have, using certain criteria, certified that now the brain has stopped working and there is no chance of revival. And this brain death is a technical term we use mainly for organ donation.
Okay, sir. So, sir, what are the main causes of these neurological problems and how do they differ from each other?
So, coma can be caused by any pathology. It could be from chemical poisoning down to very commonly what we see as road traffic accidents or any head injury which may affect the brain functioning. So, this may be temporary or this may be permanent. Temporary means you have coma, you have something and you wake up the next day or within a week, 2 weeks. So, it becomes a temporary phenomenon. If it progresses from coma to, let's say, vegetative state, that means the patient has been in coma for a very long time, and based on the duration we are calling it a vegetative. Obviously, if this coma persists rapidly into complete cessation of brain functioning, we will call it brain death.
And what actually happens in coma? Like, what are the reasons of someone to enter this condition?
We are awake and talking. It's different from when we are sleeping. So when we are sleeping, we have different phases of sleep, from REM sleep to deep sleep to light sleep, but that is not called coma. When we give anesthetic drugs to a patient during surgery, for example, we induce a coma in that patient. So this means that there is a stage after sleep, even after deep sleep. So sometimes it's difficult to revive a patient or a person from deep sleep because we have to call out very loudly. Sometimes they don't wake up despite shouting. So they are in a very deep sleep. If you make that person further go into a deeper sleep, we will call it coma. Why does it happen? There are certain regions in the brain, technically we call it reticular activating system or RAS, that is responsible for the conscious state we are in. If that system gets damaged, deranged or chemically sedated, a person may go into coma, or layman terms, very deep sleep from which he cannot be woken from.
Okay, sir. Sir, what about vegetative state? How long can someone be in that state?
See, the proper question is, firstly, how long does a person need to be before we call it a vegetative state? There are different rules in different countries. In US, maybe 3 months a patient has to be in coma to be even thought to be in a vegetative state. And in some countries it takes 6 months to be in coma before we start labeling him as vegetative state. How long a person can be in vegetative state is very difficult to. They can be for decades, or the people have been there for 20-30 years, and scientifically they are not supposed to wake up if they are in vegetative state.
Okay, so like, is there any hope for improvement?
As a doctor and as a scientist, I would say the hope is zero, but obviously this whole world lives on hope, and we keep hearing anecdotal reports of patients getting up from coma. Now, as I say again, we have to see the cause of it. If it is a trauma or traumatic brain injury, the brain is usually very severely damaged, that the hope of any person recovering from a long-standing coma are almost nil, but never zero. If it is for some other reason, from some kind of a stroke or some kind of chemical poisoning or something going on, the chances are better. So everything is very fluid. and nobody can pinpoint that yes, 100% this patient is never going to wake up, but chances are almost zero for the vast majority of patients.
So, sir, can someone wake up suddenly from coma, like as it is depicted in movies?
The movies, obviously, it's a little bit of hyperbole, and usually I have not seen in my personal experience anybody just waking up from coma absolutely normal looking, because they have suffered obviously some kind of brain damage, which even after waking up they will be severely restricted in the type of functioning or cognitive functioning they will be having. But yes, if it is a reversible cause, as I said, maybe because after a day or so the patient is in coma and it is because of chemical or metabolic causes, he might just wake up.
Okay.
And that is entirely possible.
So, how can the difference between coma and vegetative state can be determined?
For a vegetative state, as I said, there are strict criteria. One, the patient has to be in coma for a minimum period of 3 to 6 months, and all the causes which are reversible should have been excluded. So if all reversible causes have been excluded and patient has been in coma for a very long time, what happens to them is they start opening their eyes. So they open their eyes. If you give them something to eat, they will swallow that also. However, they will not respond. So if you talk to them, or they will not respond at all to any command. So they are like zombies. This is why we call it vegetable or vegetative state, because they are like vegetables or trees, plants, anything. They will not respond.
Got it. Okay. So, is there any treatment available help them to recover from these states?
There is, once a person has entered technical vegetative state, obviously we have all tried our best in whatever science has to offer as of today. And after that, it is just good care of the patient and holistic treatment in the hope that something might happen.
What is the main difference between brain death and vegetative state?
Brain death is an entirely different entity in which the patient is technically dead. Only the heart is functioning, and that also because the patient is on a ventilator, on external means of support, which is allowing the heart to continue working. Brain has already died. So for all practical purposes, as a human being, if the brain is not functioning, you are dead in a way. All these patients, these are usually patients of severe traumatic brain injury. We have certain criteria by which we diagnose them as brain death. Is only applicable in India, that once we diagnose them as brain death, they are legally dead, but they are not technically dead. Okay. Because heart is still functioning, they still have a heart rate. So what we do is we take this time for organ donation if the relatives agree for the same.
They don't have like any signs or symptoms of being alive, such as breathing or reflex movements, nothing.
See, breathing, as I said, for the patient who is being declared as brain death, the breathing is being done by the ventilator. They will not have any spontaneous breathing. They will not have any reflexes, except for the spinal reflexes, which are separate from the brain, and obviously they will fit the criteria we have for brain death. So that is a very strict criteria, and there are only clinical criteria. You do not need any test to diagnose brain death.
Okay. So how is the diagnosis of coma, vegetative state and brain death is made in clinic? What support is available for the patients?
First of all, we need to find the cause. For finding the cause, we take a good history, and then we can do a CT scan. MRI is required, complete blood workup, chemical toxicology and all. So make sure that there is no cause we are missing out for those patients. Sometimes the cause is very apparent, like a traumatic brain injury, it's very apparent this is a trauma. For the others, it might be a little hidden. Mainly to find the cause, we do a lot of tests. Other than that, we are then working on the clinical acumen, doing some clinical tests in terms of respiration and other reflex tests to decide if the patient is in coma, deep coma, vegetative state, or in brain death.
Okay, so what are the main clinical symptoms and the diagnostic criteria for these?
For the coma patient, we have a clinical scoring system known as Glasgow Coma Score. So the name itself implies a coma score, and its abbreviation is GCS. So in this, it has 3 variables. One is the motor response, other is eye response, and third is verbal response. Based on values we give to each response, we come to a total score which can vary anywhere between 3 and 15. So a person 15 is like you and me, talking
Okay.
and completely fine.
Yeah.
A person 3 is deeply comatose, almost on the verge of brain death. So this is the difference between, and this is the clinical.
Okay, so are there any challenges in correcting, diagnosing and differentiating coma, vegetative state and brain death, especially in the
Yes.
cases where there are uncertain outcomes in the
Yes, there are always challenges. In fact, we used to read in the newspapers occasionally once a year or more, where we find that a patient was declared dead and he lands up in the mortuary in the deep freezer and then he wakes up. So this happens
Okay.
sometimes, occasionally,
Yeah.
because of the challenges faced while diagnosing between these three entities, coma, vegetative state and brain death.
So what is the significance of neuroimaging techniques such as MRI and ECG in the assessment of patients with coma and vegetative state, and how do these tools diagnose and in the prognosis both?
We need to have these tools such as the MRI, CT scan to find out the cause of these diseases, or to find the cause of why the patient has gone into coma, and also to follow up serially whether any changes are happening. That is number one. But by and large, the management of the patient is clinical. So as I said, GCS or the Glasgow Coma Score is the gold standard for evaluating these patients and predicting how the patients will do down the line. Down the line means 6 months, 1 year, 2 years down the line. We use these tools very occasionally, but most of the time, day-to-day working, we are using a clinical acumen.
So lastly, what are the common misconceptions or myths for these coma, vegetative state and brain death?
Yes, so one of the most common myths is coma means everything. So coma is obviously a very layman word. It has different meanings for different people. Coma doesn't mean brain death. Brain death is completely different. Coma doesn't mean vegetative state. Vegetative state is completely different. Patients in vegetative state are unlikely to become conscious. People feel that if eyes are opening, that means he is likely to improve. That is wrong. Vegetative state patients, eyes can open anytime. They can even look around, but they will never focus gaze. So this is important to understand. And thirdly, most importantly, brain death means, for all practical purposes, the patient is dead and you should consider that patient for organ donation.
Okay, with this, thank you so much, sir. Thank you for your time.
Thank you.